Hi everyone, Whitney Lowe here, and today on our Clinical Insights video, we're going to be talking about soft tissue pain. In particular, 3 different types of soft tissue pain. You might have heard some of these terms before, or maybe not have heard them, but they are important distinctions about what kind of pain your client might be experiencing, and then of course, what's going to be the best way to address that. So let's look at these 3 different terms that we're going to be talking about. We have 3 different types of pain. The first is nociceptive pain, the second is neuropathic, and the third is called noplastic pain. They have some similarities, but also some important and key distinct differences. So let's take a look at them individually. So the first type that we'll look at is nociceptive pain. And this is pain that results from actual or potential tissue damage. It generally is considered pain that is coming from heightened stimulation of those receptors, those sensory receptors that we call nociceptors. They are sensitive to chemical, mechanical, or thermal stimuli that say that there's something wrong, and in particular, that's likely some type of tissue damage or injury that is perceived, and if something isn't done about it, it could be a dangerous situation for the body. So this is nociceptive pain being generated by sensations from those individual sensory receptors. Typically, nociceptive pain is localized to the area of that potential tissue damage. So this is your pain coming from muscle strains or ligament sprains or some of those other types of localized soft tissue disorders, tendinosis, for example. All of these are examples of nociceptive type of pain. Generally, it's described as maybe sharp or aching or throbbing sensations directly associated with that level of tissue damage. Now, it's important also to indicate that the level of pain that is felt is not always consistent with the level of tissue damage. You can have a high level of tissue damage without sufficient pain sensations, and you can also have very significant nociceptive pain sensations that don't necessarily correlate with some specific tissue damage. That's why we also frequently refer to this as not only actual but potential tissue damage that might be felt. Now, from a massage therapy perspective, we'll tend to focus on nociceptive pain treatments, zeroing in on that primary area of pain. So if, for example, it is a ligament sprain or a muscle strain, we're going to try to focus in on those specific areas of problems. Try to do maybe friction techniques or some other type of treatment technique right on that site of primary injury, mostly to stimulate fibroblast activity and encourage some greater degree of tissue healing that might come directly into that area. There are also significant benefits in doing this particular type of treatment because the client can note that, yeah, that's the point right there. That's the place that really hurts. And when they have that sense that you're able to find that location, there is a greater sense of confidence in your ability to do something that may be changing those tissues. So even whether or not our techniques actually produce a physiological change in those tissues specific to what we think is happening with that particular technique, the benefits of targeting that type of treatment in a nociceptive pain problem are very effective in making that treatment work more effectively. Now, the next type of pain is called neuropathic pain, and this is pain that results from damage or dysfunction to the nervous system itself. So when we think about it, the nervous system, the nerves that carry those sensory signals from the periphery, those are basically the transmission wires, but you can actually damage the transmission wires, and that can cause significant pain sensations as well. So when there is damage or irritation to these nerve cells or to the nerve trunks themselves, this is called neuropathic pain. You're probably familiar with many of these kinds of conditions like carpal tunnel syndrome or thoracic outlet syndrome, or what's commonly referred to as sciatica, or irritation of the sciatic nerve or the nerve roots in the lumbar region. These are all examples of neuropathic pain because the problem comes from some type of irritation. In many instances, it's compression of nerve tissue, but you can also overstretch nerve tissue and cause a problem with adverse neural tension by pulling a nerve tissue and causing damage to it. These are all indicators of neuropathic pain. The most common signs and symptoms that we get from neuropathic pain are usually those that are described as burning or shooting sensations, oftentimes an electrical type sensation, and they may correspond with numbness or the pins and needles paresthesia type sensation. So these are all indications of some type of damage, irritation, or irregularity in the signal processing in the nervous system, generally indicative of neuropathic pain. Now, one of the important things for massage and manual therapists in dealing with neuropathic pain is recognizing it first off, but then understanding how to address that. And because it might involve some type of compression or irritation on neural structures, you need to know where that might be occurring. And this is one of the big challenges that we face. An important process or role in that is to try to accurately assess where that compression or irritation or tension or some type of irritant to the nervous system is occurring, and see if we can find a way to relieve that. Sometimes it's tight muscles that are compressing or pinching a nerve. Sometimes there's a bony structure or an obstruction like a disc or some type of bone spur, something that might be pressing on the nerve and causing that irritation. Now, for a number of these things, we can't do anything with massage or manual therapy, like something that's a bone spur in the intervertebral foramen, which is pressing on a nerve root. We can't really do anything with that with massage. But there are things that we can do to help reduce the irritability from those nociceptive signals and the irritation of that neuropathic pain to settle down the nervous system and decrease the pain sensations that a person is feeling. So while some of our techniques are going to be a little bit more specific and directly focused on trying to free up and loosen and get those nerves uncompressed and stop whatever is irritating them, some of the other strategies that we'll be using are going to be a bit more general in that they're trying to really help settle down and reduce irritability in the nervous system. Now, the third type of pain sensation is called nociplastic pain, and this is one of the most challenging ones because it is pain where there is no real clear evidence of tissue damage or any type of neural involvement. So this is pain without a real clear indication of what is causing it. It really arises from altered processing in the nervous system, in the central nervous system. Sometimes we develop what's called sensitization, which is an exaggerated sensitivity of the nervous system. So this is not coming necessarily from damage to nerve tissue like the compression of a nerve structure that we see in the neuropathic pain, but it's just an altered sensation. Maybe you've had somebody that says, they come in and say like, oh yeah, if you just drag your fingers across my skin, that just really hurts. That's a heightened degree of sensitivity, or they feel there's wide temperature fluctuations. I'm always cold in my feet. I'm always burning in my feet, or something like that. This can be occurring without any specific tissue damage causing those things, but it's an alteration in the proper signal processing within the central nervous system. And that is what's characteristic of nociplastic pain. Some of the conditions like fibromyalgia or the whole body systemic pain sensations that are highly exaggerated, these are examples of nociplastic pain as well. One of the reasons that understanding nociplastic pain is so important for massage therapists is that massage therapy can be a really effective way to help address this type of problems. Many of our techniques are going to be aimed at general soothing and relaxing of the nervous system, and that's what you need to do with nociplastic pain, because there isn't really a single site to focus on in most cases. It's more of a general approach that needs to be done to help address and reduce the irritability of that nervous system. So soothing and relaxing things that really enhance what we call descending modulation, which is a neural process that can help sort of tamp down or turn down the volume on those signals of nerve irritability. That's going to be our important strategy with nociplastic pain. Try to turn down that volume, get the whole nervous system settled down as much as possible. So you don't even need really fancy techniques to do this. Just really good general soothing, relaxing massage can be so beneficial in addressing this type of pain problem. So those are our three different types of pain sensations that a person is likely to bring to you. Nociceptive pain, that is pain that is caused from actual or potential tissue damage at a single site. Neuropathic pain, that being which is caused by irritation to the nerve structures themselves. And nociplastic pain, which seems to be coming from no specific incident or location itself. It's just a much more generalized sensation that is the result of erroneous signal processing by the nervous system. Many of the techniques and strategies that we work with in our orthopedic massage programs focus on identifying the type of pain problem that's there and look at key strategies to help address those pain complaints so that you can get the best results with your clients. If you're interested in that, we'd love to have you come join us. Come check out those courses over on our site at academyofclinicalmassage.com. And do be sure to like and subscribe to the video so you can keep up with other interesting topics along the rehabilitation area that we focus on with our orthopedic massage applications. We'll see you in the next video.